In the beginning of this semester, I spent time with the clinical staff and providers to hear their concerns about the process for universal suicide screening. I also did a SWOT analysis to identify the strengths, weaknesses, opportunities, and threats that existed in my practicum site. The strengths to support implementation of a universal suicide screening program that I identified include that City of Hope provides services to patients with cancer who are known to have an increased risk for suicide. These patients are faced with a complex diagnosis and often have many opportunities for interactions with the oncology team. The oncology team builds a trusting and therapeutic relationship with the patient and creates a safe space for open discussion. City of Hope uses the Columbia Suicide Screening Tool, which is validated and endorsed by the Joint Commission and is considered the gold standard for suicide screening. Providers and clinical staff at City of Hope Corona are highly engaged, compassionate, and have a strong commitment to performance improvement. Weaknesses that were identified to interfere with the successful implementation of universal suicide screening include the lack of clarity and policy. The current state of the policy at this time is complex, and it was intended to cover an entire enterprise, which consisted of multiple locations with different resources available. The initial training was done online, which did not meet the needs of the clinical staff. There was not a process to validate learning or the opportunity for participants to ask questions. Clinical providers and staff expressed uncertainty about how to respond to patients who are identified to be at risk for suicide and indicated that there are limited resources available to provide the support that these patients so desperately need. Finally, there was a resistance to change from both the clinical staff and the providers. Opportunities that result from the successful implementation of a universal suicide screening program in Corona will include developing a clinical network standard that can be deployed to the other clinical network sites within the City of Hope enterprise. The journey for cancer patients is tough, and they encounter a variety of physical and mental symptoms in addition to complex psychosocial challenges. There is an emerging need to provide supportive care for patients who are identified as being at risk for suicide. City of Hope has the opportunity to build partnerships with mental health providers in the local community and facilitate care for patients that are identified to need support. Finally, as we learn from the implementation of universal suicide screening, we can share new knowledge with professional organizations and advance the profession. Threats to the implementation of a successful universal suicide screening program include socioeconomic and community demographics. Social determinants of health can have a substantial impact on mental health, including the lack of mental health resources that are available within the community. Furthermore, there are constant changes being made to regulatory requirements, which make it difficult to keep up with the standard of care. And finally, other competitors with robust programs for suicide screening and supportive care could be a threat to City of Hope.